Hello, everyone. Yes, I'm live. Hello, everyone. Good evening to my all. I welcome all of you for my live. And today, I am on my seventh day of live challenge. And as I told you, today I'm having a special guest with me. I'm not alone. I have a special guest, and we will be asking a lot of questions to him. And it is a very interesting topic. You know what? When we are talking about diabetes, it all starts from mouth, right? So we are going to explore the mouth to we are just going to dive into the mouth and we are going to explore that. For that, I have Dr. Selvanathan with me. He is founder director and chief I'm sorry. He's founder, director, and chief dental surgeon of Swasthya Dentic. His fellowship in general dentistry from CMC Vellore, Faculty of Art of Living programs. He is the secretary of Indian Yoga Association, Pondicherry, and he's National Ayush Empanelment Committee of Indian Yoga Association. He's a member of National Ayush Empanelment Committee of Indian Yoga Association. He is also disciple of Gurudev Sri Sri Ravi Shankar ji. Now, let us start our discussion with Dr. Silva. Dr. Silva, welcome. Thank you so much for accepting my invitation, and we welcome you for our live program today. What do you want to tell about this?
Yeah. Pleasure is mine, Shubhavani. Thank you so much. It's been pleasure knowing you for I think more than 4 years. So I'm quite inspired to be part of the session and address your esteemed audience because I myself is great fan of yours. Observing you, what you have been committed towards, health education in terms of diabetics. So it is one of the most important challenges what the nation is facing on lifestyle disorders. So I'm thrilled and excited to be part of this session because uh, this is what I have been envisioning to do in the field of dentistry, head and neck oncology, and oral cancer. So, really looking forward for this session. Thank you, Shubha, for inviting me for this.
Yeah, I'm also excited to talk to you regarding that. We always discuss about associating with respect to diabetes and dental related issues. Now, but I'm excited to talk about this campaign which you are running. That is the dental hygiene and mental hygiene. I want you to talk about this.
Yeah,
It is so inspiring to listen to that. So I just wanted to talk
yeah.
about. I just want
So,
you to introduce about that campaign. What is it and how is it going?
yeah, I'm very grateful to Gurudev Sri Sri Ravi Shankar for inspiring me for this because in 2012-13, Gurudev started a campaign called Volunteer for Better India. So that time I was very raw and very new. I didn't know what to do. But this campaign really, brought a lot of clarity to my life on what I wanted to do in my life, basically. So because I'm a faculty of the Art of Living programs, and also thanks to my fellowship program from CMC Vellore. Here I need to mention my boss, Dr. Rabin K. Chako, who has given me a wonderful thesis during my post graduation time where I got an opportunity to work on non-pharmacological ways of habit cessation. And we have been taught on comprehensive way of looking at dental problems. So, and a patient-centric of approach. So, dentistry as such, it got redefined when I, completed my post-graduation from CMC Velo. And that's how dental hygiene came up. And mental hygiene, it goes without saying, thanks to Gurudev Sri Sri Ravi Shankar and his teachings and my training with the Art of Living Foundation. But the Volunteer for Better India movement is nothing but giving 1 hour of your time to nation building. So, suppose say you are a plumber or you could be an electrician. All you need to do is just to empower the people, youth, or common man about your skills. Offer that for free of service, free of cost for the nation building. So that way, every day 1 hour or a weekend or a month, you can spend 3 to 4 hours. Offer your time for the nation building activities. So that's how it all began. When I introspected, I felt, what is my skill set? What is the best thing that I have? One, as a dentist, yes, I do have a great perception towards dentistry when it comes to education part. And similarly, the another profession is as a faculty of the art of living programs. And I felt I should come up with 1 hour of my time, giving it to the citizens. So what I thought was, half an hour, let me put my efforts on dentistry. Half an hour, I'll put my efforts on this mental health solutions. Because this idea, it came up when I heard Gurudev's talk, where he gave an analogy on how brushing is important for dental hygiene. Similarly, meditation is important for mental hygiene. So that's how it began. And so this is the revolutionary thought behind this movement, you can say, dental hygiene and mental hygiene.
That is amazing. Brushing for dental hygiene and meditation for mental hygiene. Oh wow, that's an amazing analogy, right? How basic it is. It shows like how basic it is for us to brush the teeth. That is how basic it is to meditate, and that is really amazing. But meditation is something that we are not giving importance in our busy schedule, right? How do you look into it, and what are you doing in your campaign part of mental hygiene? What is that you're doing to inculcate meditation in layman's life?
Yeah. Before I come to that, I need to dedicate this thing to my friend, my late friend, Mr. Satya Seelan. Satya Seelan is the reason behind Swasthya Dentic. Swasthya Dentic is our dental clinic, and Swasthya means disease-free, healthy state of being. That's what I understand as an allopathy side. And dentic is a term which I just randomly coined. Seeing a boutique, I just felt dental clinic is too common, so why
Dentic.
not dentic? So
Yeah,
when I started this in
got it.
Vellore, my friend Satya taught me the power of truth, and his name itself is Satya. So Satya ran a company called Nijam, a cause for concern, where he has done. He's a filmmaker, cinematographer. Sorry for me taking a little more time, but because without mentioning Satya, I can't proceed further. The Nijam is his company, where the slogan goes like this, a cause for concern. He did photography exhibition with biggest stalwarts of Tamil cinema, including the great people in the industry. The analogy what he drove is this. Balu Mahendra sir. Sorry, I was trying to remember the name. Mr. Balu Mahendra was one of the guests in that, and Mr.
Okay.
Madan, he was
Okay.
there. So there are a lot of Director Sharon, all these great people were there. Why? Because he
Okay.
ran a social cause to create a funding on that photographic exhibition, where he did an analogy on the temples which has not been taken care. So the destroyed
Okay.
temples, he took photography in a sunlight where half were shadowed, half were with sunlight, and it's all something which were not taken care. He compared that analogy to the senior citizens, where we haven't put our attention on taking care of our parents or senior citizens, pushing them onto the old age homes. To generate fund to an old age home, he had his company called Nijam, a cause for concern. So I really miss Satya sir, because he taught me the value of truth. He taught me the value of goodwill, the currency called goodwill, what it works in the world. So uh, I am offering this to Gurudev and also to Satya in the name of Satya Nijam, a cause for concern. In that, Swasthya Dentic social transformation projects of dental hygiene, mental hygiene has taken off in a very, very big way. So thank you, Shubha, for me to talk about Satya sir, because he's very, very close to our art. Or everybody who's part of
That is
Swasthya Dentic.
inspiring.
Yeah.
Yeah,
So
person behind or the concept behind this movement, right? That is really
yeah.
inspiring, and that is what I always say, that that you will need to have a purpose for running anything. I learned it from my mentor, a statement: the bigger the why, easier the how. You don't know how this
Yeah.
happens, but if your why is bigger, then definitely it reaches to places. So that way, I really got
Yeah, sorry,
inspired,
Subha.
and I hope
I
it.
have to. Thank you. I have to interrupt you and continue what you have asked for. You asked me the dental hygiene and mental hygiene part, right? So I just give a very short, very short 3 point agenda in that for both. What are all the root causes for dental problems and then the mental health issues? What are all the root causes? And in
This is
dentistry,
about your
probably
campaign. During your
campaign.
campaigns, you do this, is it? Okay.
Yeah. Say you can say it could be a talk to begin with, a
Okay.
talk 1 hour of my
Okay.
time if I devote to a dental hygiene and mental hygiene workshop. What I would be doing is first I will talk about the root causes of the dental problems and how one
Okay.
can identify early signs and symptoms so that they can come as soon as possible to their own dentist, and also about prevention and wellness in dentistry. What are the simple things that they can do at their home so they do not have to meet the dentist with a bigger dental problem? So, this is on dental hygiene. And when it comes to mental hygiene, yeah, not many things to talk about. We all know the lifestyle disorders and food habits, and so many things are there. As you said, Shubha, aptly, there is no education on this, neither in the schools nor in the colleges. Never the community or even the parents have taught us the ability to handle our own mind and emotions. So when that is lacking, how can we tell people to calm down? And see, in this era, for silencing the world, we have to shout. Just utter the word silence so loud to acquire the attention of the people. So that is how challenging these times are. So understanding this becomes a root cause of the mental health issues. See, because of this, either one gets into depression or into aggression. The violence towards the self gets into depression and suicidal tendencies, or the aggression becomes violence towards the society, becomes the extreme form of violence, becomes a terrorism. So neither of this is good. So understanding this and the solutions, of course, breath becomes a very powerful tool in handling body and mind. So emotions cannot be dealt directly. Mind can never be dealt at the realm of mind. But with the breath, yes, it is possible. And of course, the pranayam breathing techniques make a significant physiological and psychological differences. If you see, there are a lot of researchers are good enough to prove that. And yeah, meditation, it makes you more beautiful. I mean, if you interact with someone who's a meditator, and also who's experienced in teaching meditation, you will see them more happier and calmer and vibrant, and I mean, they enjoy the world. At the same time, they don't get stuck with these challenges, or even if they get stuck, they come out of it very easily because they know they have the tools to handle that. So this is what I discuss and I hear from people, and this is what we do in dental hygiene and mental hygiene workshops. Thank you.
Wow, that is really amazing. So, basically, you give awareness to people, and whomever they are in need, you also take a step forward to teach them meditation and also guide them on the dental uh, issues. Awareness to the practice. Now, these two things, dental hygiene and mental hygiene, both are somewhere related to my people as well, diabetics. So,
Yes.
how do you relate it, especially mental hygiene? Yes, we all know about it. Directly, mental hygiene is related, impacting the blood sugar levels. And dental hygiene, a lot of them do not have this awareness how this dental hygiene is happening. having the impact on diabetes? I would love to listen from you, because yes, there is a complication associated with that. Diabetes complications, there are complications which is completely ignored. This part in diabetes is completely ignored, right? How do
Yeah.
you see this, and what is your insights with this respect?
See, it is there's a lot of science on this and a lot of a lot of theory or papers, research articles are available. Anybody can get into this, and it is so common. But what is alarming is very less people are working on this. When I say this, very less people, because we are too stuck with dealing with, say, if a specialist is there working on diabetes, it's like we don't treat the consciousness, we don't treat the body as a whole, we treat the organ part. So holistic approach would help us to understand this, and this is what helped me. When I say holistic approach, this is something I got inspired from alternative medicine. Alternative medicine deals from the root cause of the disease. It doesn't treat just the organ, it treats the holistic well-being, to promote the wellness and well-being. So but there are limitations to see this with an allopathic perspective. But science is a science. It depends on the individual to see how you perceive the wisdom and express the wisdom. So both are very important. So based on the patients who's in front of us, the challenge for the clinician is very high. So coming back to what you have asked, Shubha, the foci of infection from the oral cavity to get into the bloodstream is very, very high through periodontal route. So periodontitis is the root cause of the major health issues. This is something which is
Sorry, can you please come again? I just lost it.
periodontal.
Can you please
Yeah,
come again? What is the
yeah.
root cause you've mentioned?
The foci of infection from the oral cavity gets into the bloodstream very, very easily through periodontal problems. And interestingly,
Okay.
we have a protocol for our patients that's called diabetic dental wellness. So, if
Mhm.
you observe people who are having uncontrolled diabetes, they do have a poor oral hygiene or high periodontal infections. The gingival infection is the see, very simple. A, a plaque or calculus or stains can lead to a lot of attraction towards a lot of microbes to get to form the colonies in between the space, the gum and then the tooth. It has some space, and there is a gingival clavicular fluid which gets secreted there.
Mm.
In that area, if there is so much of deposits of food lodgement, if you do not clean well, that becomes attractive colony formation for the foci to form, and slowly, since it's a bloodstream connected very easily, it can get spread to the bloodstream, and overall immunity could be in that could be a major problem. So I'm talking from the
Inflammation.
very inflammation,
It can also
infections,
lead to yeah, basic thing.
both, both,
Okay.
both. Inflammatory
Yeah.
gums
What a,
is nothing but is what called as a gingivitis.
got it. Got that. Yeah, but what is the early symptoms of this? How do diabetics will get to understand that they're having some problems with the gum? What are the early symptoms?
Okay, see, first and foremost thing is whatever that you have been teaching, Shubha, they have to follow that. What I am talking is only a little portion of uncontrolled diabetes segment which I'm adding up. But predominantly they have to just listen to you and be disciplined and committed in working towards your protocols, what has been taught for so many years by you,
Holistic
Shubha.
lifestyle.
Holistic lifestyle, yeah, very, very true. Good food and exercise, and regular medical checkups if it's required, and follow the medications what is prescribed by the physician, and a disciplined lifestyle with proper guidance from the doctors, and also see what they can do in terms of oral hygiene. That's how I would put it across, because people shouldn't take it in a wrong sense that bad oral hygiene is the root cause for major diabetic problems. No, that's not the thing. First, they have to follow what you're saying, what you have been suggesting, what you have been educating, and also while doing that, if they could incorporate what we are proposing, then we are looking at wonderful solutions for them. So, to start off with, meeting your dentist once in a year is a good idea. I don't see that is happening in general, but diabetics, I recommend twice at least 2 times in a year, you must have to visit your dentist, especially when you have an uncontrolled diabetes. Because uncontrolled diabetics have a very, very poor oral hygiene. Or the vice versa, when you have a very bad oral hygiene, you tend to have an uncontrolled diabetes. There is some
Yeah.
pathology linked in this, and when
Mm.
and it is significantly observed when your oral hygiene is clean, you have a better oral hygiene, the complications of that on diabetic index also can be seen. I mean, this is it's a common sense, everybody will get it. Um but it is not being told to people. It's not been in the part
Yeah,
of
that's
education,
right.
or the or I would say, even if the doctors tell or educate, patients are not ready. I do not know why, but somehow that's where people like you and people like us play a very significant role in their lives, I believe, where we
Yeah.
we have to
As we
continue,
started the
we have to
sorry.
we have to stay committed irrespective of whatever happens. I firmly believe, Shubha, 10 years back when I started this, people called me I'm a crazy guy, what I'm talking is something stupid. But today there are so many people like you, who is one testament about what we are doing. So I'm sure because the demand is there, people's need is there, but the supply is very less. So we should not stop, we should continue doing what we are doing. You should not stop, Shubha, you should continue doing what you're doing. You're doing an amazing contribution to the nation building, because non-communicable diseases is a threat for the nation today, at least in India. And diabetes, we have become the capital
Yeah.
of the world. So it is imperative that there are so many Shubhavanis rising above their levels, and doing what you are doing, replicating, or even do something much bigger or better than what you are doing.
Thank you so much for that. This motivates, as you were saying, like we have to tell. That is what our duty is. We should keep on saying, and one point in time, that awareness will come to people. That is what we are seeing the first time, second time. They will just ignore it. But when they face those challenges, when they are coming up with those symptoms or complications, then the awareness raises, then they come to us. But what we are seeing, prevention is the best thing, so we will need to work towards the prevention. We are giving that awareness to people. Thank you so much, and I really
Yeah,
liked it. And
Shubha,
I have
I know
one
you're
more.
running. I know you're running short of time. But before you come to the last
No
question,
issues.
I need to
No,
complete this aspect of yours, because you've asked this question to me: how they can find early signs and symptoms, right? Very simple, Shubha.
no
People
issues
are
about the time. We can talk
okay.
about it. No
Okay,
issues.
thanks.
No issues
Because
about the time.
this is the most crucial thing that we fail to
Ex-
address to the
yes.
people. Uh, you know, if there is presence of pain, then they consider it as a
Mm,
problem. Absence of pain, they equate it into a good health. So I'm
true.
asking, what are the minor signs and symptoms that you are missing and taking it for granted? So there, I would like to tell our audience that there are minor signs and symptoms. Please consider that as a problem. So you will never land up with a pain. So what are those? Bleeding gums, bad breath, food
Mm-hmm.
lodgement,
Okay.
tooth discoloration, sensitivity of the
Mm.
tooth. Like this, all these are very simple, basic, normal issues. But if you put your attention on this and take some measures, I think you will arrest 90% of the major dental problems at this stage. But for that to happen, you need
Okay.
to visit your dentist. You have to go to the, you need to choose the right person. I do not know how to provide a solution to that, but find the right person who's very passionate on promoting dental wellness and well-being and working towards the prevention and towards the dental lifestyle modification. So if you could find somebody like that, please stick with them, follow meticulously what they are saying. And there are preventive health dentistry departments. So if you find preventive health dentistry MDS, then they are the best person to go talk to. And anybody who's very passionate on dental lifestyle modification, stick on to them and follow whatever that they are saying. If you find any of these 5 or 6 symptoms, that's the sign, that's the early signs and symptom that you have to go meet your dentist. And even before that, just make it as a habit to brush 2 times daily and meet your dentist once in 6 months. Follow whatever that they are saying. This is the little that I would like to communicate and convey to our audience. I hope it benefits them. And one more time, I tell this very seriously. They really have to reconsider their thought on how much they are committed to your education protocols
Lifestyle.
on diabetes.
Yeah. Okay. While you're talking about tooth discoloration, I also wanted to ask you how much, because especially we're talking about carbohydrates digestion or metabolism, it happens in the mouth, right? So how much importance it has a lot of importance with the tooth alignment and the food we eat, right, with respect to digestion and
Yeah.
metabolism. Can we also talk about that? Is there a connection? I always feel sometimes, definitely people, we in the urgent busy schedule, we are not chewing food properly and eating. But is there a connection with the tooth alignment as well?
Uh, Tooth alignment, I do not know. I'm not sure about that. I don't see there is any correlation with the tooth alignment as per se. But definitely, when it comes to acid pH level of the oral cavity, if that increases, then definitely there is a high possibility of bad oral hygiene and bleeding gums, cavity formation. So the salivary pH plays a very important role when it comes to good oral hygiene. For that, diet becomes a very, very important tool. And if you chew properly, I'm sorry, if you chew properly and eat well, while you're eating, if we can, focus more on eating. I mean, this is one of the challenges even I go through. But like everyone is going through the challenge, like all of us, if we can have little more attention on food, then
We
it
don't
can
have
make a
time.
difference. No, we have time. We are not prioritizing. We don't prioritize ourselves on others. So I wouldn't say we don't have time because everybody is having 24 hours. So it depends on how committed that you are and how much priority that you. It's all about prioritizing. That's it. If the same person is going to have a, I'm sorry to say, if someone is suffering from cancer, do you think that they will hesitate to make their lifestyle change? No, the entire family will be
Yeah.
behind that,
Yeah.
right? So if one has to
Yes.
get amputated
Yes.
with their leg with the diabetic foot
Mm.
complications
Yeah.
because of
Oh,
gangrene,
yeah.
do you
Yeah.
think that they will think
Yeah.
twice? Why do we want such an extreme measure to go ahead with the lifestyle modification? I would
Exactly.
say we all should work towards policy change in India right from the school levels. We should work on lifestyle creation rather than lifestyle modification.
Okay.
So if I
That's
have to
right.
tell, yeah, if I have to tell your audience about what you're doing is, You are working on good habits, helping them to acquire bondage to that good habits. Hence, you are creating a wonderful, holistic, fantastic lifestyle. If you are going to get acquainted with not so good habits, you are get bonded to that, and that's how your lifestyle will be. So that is irrespective of whether it is diabetes, dental problems, or mental health, nutritional deficiencies, or cardiac problems, obesity. All these are the major problems that the country is facing, and I'm I'm deeply saddened by the statistics what is being floated around, and it makes me so restless to continue to work on this pursuit of excellence in dental wellness and well-being. So I'm sure you have the similar drive on diabetes. So if all of us, and also if people, and there are a lot of young people now, if you see, they want to get into fitness. Why? Because they are scared about the lifestyle
Yes.
problems. So that is a very positive sign in another side, I would say. But right from the childhood, if we can do lifestyle creation, in the 30 years, 20 years, we have a beautiful future lying ahead of us.
That is really an amazing point that you have given me. I was doing campaigns on lifestyle modification. I think I should start my campaigns on lifestyle creation. That too,
Yeah.
people in the early 30s and late 20s diagnosed with diabetes. I feel really sad looking at them struggling with challenges, complications, and all. But if we do this lifestyle creation, and this they will not get into the stage at all, right? So that should be that should be one of the segments I have to work. And yes, that's nice. That is very impressive to listen to you. Thank you so much for spending so much time with us. Yeah, the platform is yours. In general, do you want to say something for us, for people in general? Yeah, the it's
I'm
open time for you.
I'm very grateful to you, Shubha, because for a very long time I wanted to talk about this on a platform, on an online platform, and for me to have a video on this, because I've been talking this one to one to the groups, but I've never recorded this video. I need to thank you for giving this opportunity to capture this live while interacting with you, and to have this as a medium of education. I mean, this one video is good enough for me to share it to all my patients, where we also talk about diabetes and also talk about dental issues and mental health. Though we haven't gone in depth about the mental health solutions or the problems, but it is well known that pranayam, meditation, breathing techniques, it heals and it brings holistic changes. So on a broader perspective, I'm very grateful that I got this opportunity to interact with you, and I'm also grateful to your audience who have been so enthusiastic in allowing you to come to this level. If there is no audience whom we can speak with, right? So
Yes, yes.
in this series, I feel I am very fortunate to be part of this. And so thank you, and thank you to all your enthusiastic volunteers and followers and participants of yours. So I'm looking forward for many such interactive sessions in the future.
Yes, definitely we will make it. Today, I want to learn about the dental hygiene, and that is why I was focusing on that alone. But in the future, we will also talk about mental hygiene. And yes, that anyways we are doing together, part of Indian Yoga Association, associated in
Yeah,
together working on many projects. So I also want one more thing from you. If
yeah.
I want to tell my clients, diabetic people, to incorporate one single habit for their dental health, what can be that part of the lifestyle, part of the holistic lifestyle? If I want to incorporate one habit, topmost priority, what is that?
I would tell this as an analogy for them so that they understand it very, very effectively and easily. I will tell them to brush well. Just brush well. 360-degree of your tooth has to be cleaned well twice daily. Gargle your mouth after eating or drinking anything other than water. That's it. So, how an analogy will help? Suppose, see, you are in one room. Okay, if me and my maid have given an opportunity to clean my living room. Okay, this is what I tell my patients. My living room, and I have given an opportunity to clean, and if she is given an opportunity to clean, Shubha, I'm asking you this: who would do a better job, Shubha? Me or her?
You,
Me or her?
you,
No, I would say her because she
it's
knows the
you.
right tool. No, I would say it is her because she is more experienced than me in cleaning the floor. She knows how to use the right technique, right tool. Most importantly, she's been doing this every single day, 2 times for so many years with so many people. Like that, if you know right tool, right technique, and do consistent practice of brushing properly 2 times daily, I think you will never ever have to meet dentist with a bigger dental problem. So that's one thing I would
That is
say.
amazing. That is amazing. With that, thank you so much. I know you're so busy. I was wondering which dentist will have appointment that too on Sunday evenings. Okay, but you had that still. You could spend some time for us, and I'm so thankful. As you told in the beginning, we know for some years, and we are working together. Uh, and I'm so excited to have you with me on for my audience. And we will do a lot of sessions like this. We will talk on the mental health, and we will talk about our programs as well during the life. Thank you so much for being with us today evening. Thank you so much. Thanks, Dr. Silva. Yeah.
Thank you, Shubha. Thank you so much.
Thank you.
Bye.
Thank you,
Bye bye.
everyone. Thank you, everyone, whoever joined live with us today. Hope this session was useful for you. And we will come up with a lot more topics in the future. Thank you. Thank you. Bye.